This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch. Featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now Health Watch, and your host, John Damazzi.
Well, before we get started, we certainly want to wish everyone a happy Father's Day and hope that you're going to be enjoying with friends, family, loved ones, all of that good stuff. As always, good to have you with us, and we'll have a Father's Day theme for the show today here on Health Watch. Every Sunday, 8 till 9, Talk Radio 1210. And, of course, as you heard the man say, Dr. Molly FANTASIA is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. As always here on the show, we discuss the who, what, when, where, why, and how of Innovative Medical and how it can help potentially anyone, you or your family, as far as your overall health picture is concerned. So we talk about that. We call that our mission statement. And, of course, we're always welcoming you to call in with your health questions or your medical challenges that you want to run by Dr. Molly. 855-839-1210 is our number here. 855-839-1210. Dr. Molly's ready to talk to you at any time here in the course of the show, and we do want to wish Happy Father's Day.
We sure do, yeah. John, to all my patients, all the patients of our facility, and all the patients, and of course to my doctor, Dr. Mark, and also to you, John.
Thank you. Mm-hmm. We always tell this story, but it's appropriate today.
Oh, yeah.
This shows you the wisdom of fathers. Dr. Molly, you were about 5 when you got your chemistry set?
Sure.
You were 5, and your dad didn't buy you dolls. He bought you a chemistry set.
Yeah.
And there you go. And the rest is history, as they say.
I think he bought it as much for himself as he did for me, but we really enjoyed it together.
Exactly. And then my father bought me a tape recorder.
That's great.
Which I still have, which is sort of like a relic and a reminder of how I started, and with microphones. And, I mean, what kid at 11 or 12 is playing with tape recorders and microphones?
Well, your dad was a smart man, John.
Right.
That's it.
So happy Father's Day to all. And again, 855-839-1210 is the number here, 855-839-1210. Let's talk about Innovative Medical. And you often talk about it, but it's sometimes hard for people to understand what you do and how it's beneficial and how it's different. So explain the whole philosophy of Innovative Medical.
I think we start by saying Integrative Medical Associates is a cooperative of healthcare providers who are like-minded, meaning we can do anything a primary care facility has. The joke is 2 doctors, no waiting in our place. And also, But what we like to do is we like to augment anything that we could do in primary care, which is give you a prescription, give you some radiology orders, anything like that can still be done out of my facility and also with the Innovative Group. However, our philosophy is very different. We want to use the least amount of pharmaceuticals to correct the medical challenge, keep the patient at risk, and thereby reduce the side effects, both from the prescription meds that sometimes compound some of the side effects that people are having from the condition itself.
So the difference with Innovative Medical is the hydration.
Correct. It's also the use of natural products.
So it's twofold.
It's twofold. And really, you have to realize, I never tell anyone, throw away your medication. You know that, John.
Right, exactly.
Lots of our patients have medication that are either prescribed from their primary doctor or prescribed from our doctors. So the bottom line is you don't just throw your medication away. But if we can help eliminate some of the side effects from the medication, we already see improvement in quality of life.
And many times you've talked about that. And
it's unbelievable.
You've given us examples of how people have been on certain meds.
Right.
And you've been able to wean them off.
That's right.
In time.
In time. Or what happens is that possibly the physicians will prescribe an additional med to help the patient get off the med they're on in a way that's appropriate, medically appropriate. The one most important thing is to improve the quality of life of any and all patients.
You've also talked about side effects, and people know about side effects because every drug commercial you watch on TV, they go through 15 seconds of
disclaimers.
Disclaimers. Yeah. Well, if you have this, and if it's Tuesday and it's raining, don't take the medication. Can you talk about side effects of hydration and natural products?
Well,
are there any?
Course,
are there less? Or what?
Of course. You have to do your hydration very carefully. I mean, we just don't throw fluid at people. We have to make sure that they're medically appropriate for this. But overall, I would say that in 26 years, I think I had one case of hypoglycemia, and the reason being they didn't eat for 2 or 3 days. They came in, they were completely dehydrated, and vitamin C can reduce your blood sugar. So when you're there, you see I have crackers, I have water. I want to make sure patients are comfortable through this process. The other thing is, can you get side effects from nutraceuticals? The answer to that is, of course, just like everything else. If you're allergic to a substance and that substance happens to be a nutraceutical, like some people have an allergy for particular fruits. Well, would I give you an extract from those fruits? No. That's why history is very important.
We've often talked about this as well, about the health food stores, and people just go in and buy things. And that's why you come in, because you and your nurse Barbara give out really good advice as far as to what to take and where to get it and why to take it.
Yes, I mean,
don't just go in and buy something.
No, because there can be many things. The other thing is, John, the big key to what we do, I believe, is this. It's the synergy of the nutraceuticals delivered by the hydration, which allows us to get to a therapeutic level, which means the level is therapeutic. It can institute the change we need to see the improvement in the patient's quality of life.
You remember the niacin story?
Yes, that's the other one.
You had the patient with the niacin, and they came into you and they showed you all the stuff they had, and Dr. Molly, I don't feel good, and blah.
Here it is.
And you said, wait a minute, hold on a second.
10 things had niacin in them,
right.
And none of them were non-flush.
Right.
And so, yes, that patient had a problem, and that's the thing. That's why sometimes we can't. The other thing is, you want to know the quality of a particular product, because if it has hidden ingredients that you may have an allergy to, or more likely, like we once talked about your ED story, where you were at a men's conference, and what this guy had these pills, right, that were insane.
He said, take this. He said, you'll be going straight for 3 days.
That's great.
And I showed you the pills. You said, yeah, you're going straight to the funeral home.
That's right. Because it had products in there that actually were steroidal compounds. Also, it had things in it that were, the kinds of things that juice you up. So it was like, what the heck is this? And I will tell you a funny story. That you were there that day that one of my physician patients were there. Do you remember? And he sat down and we were talking about this story. And he said, well, if this thing works for 3 days straight, I don't want you to call anybody. He says, you know how they tell you on the box, call your doctor? He said, no, call all your friends if you remember. Yeah. And he was a physician. Yeah. And he said, Dr. Molly, you just helped this guy's life. I said, yeah, I know. But
the point is, and of course we're making jokes out of it, but the point is,
you want to know.
You want to know, and before you do something like that, particularly going into a health
food
store,
yes,
because I mean, you walk into those places.
Sometimes, though, the clerks are very nice.
Good.
Sometimes,
but you can't go in just blind and say, "Well, give me this and give me that."
Aisle 10. Right. Go to aisle 10, right, and get everything, and that's going to be fine. And don't forget to take it all at once. Now, that's really the key. Synergy is very important.
And that's what you do with your protocols.
Right.
You've developed them with the synergy of
that's right.
whatever is in there.
Is going to work.
So it's going to work. So it's carefully set up.
Correct. We don't want things to compete with each other. That's crazy. Okay? And it's useless for a patient. You have to do things in a synergistic manner. And you have to have some thought to this. I mean, there are many protocols out there that have been around for 25 years, and a lot of the spas are doing it. But again, what we like to do is we want to effectuate change that really improve your quality of life, not just temporarily give you a little lift.
And we should say that you're a medical facility.
Oh, yes.
Not
well,
a
that's
spa.
what we're working
Right.
out of. Yes, yes.
It's not a spa.
No.
I've seen these ads for spas. Come in and get hydration and get Botox.
Yeah, I know.
Okay.
Yeah, I know.
We are coming up on our first break of the morning. The program is Health Watch, and you'll find us here every Sunday from 8 till 9, the live version, here on Talk Radio 1210. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. In honor of Father's Day, we're going to be discussing men's health after the break and Dr. Molly's protocols and how they can help with any potential problems that men may have. 855-839-1210 is our number here, 855-839-1210. We're coming back. More of today's Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, as they are every week when we hear her on the radio. And all you have to do is pick up the phone if you want to make an appointment to sit down with Dr. Molly and go over your issues, your situation, your medical challenge. 856-489-0505. 856-489-0505. That is the number for Innovative Medical Associates, Marlton, New Jersey. You can call now. You can call later on today. They'll be there well after we leave you at 9 o'clock. But most importantly, if you have a situation or an issue or anything you want to discuss with Dr. Molly, you call and make that appointment, 856-489-0505. And remember, the initial consultation is complimentary. Dr. Molly usually says it's about 20 minutes or so, and the next time she does 20 minutes will be the first time.
John, come on.
Well, we got to tell it like it is.
I don't know. Some days I feel like lovely Linda's pulling me out. And I said, wait, I'm not done. She goes, well, we need you here. I said, okay.
I know you're so into this.
Sometimes I really do.
And really, it just goes on and on. But
there's
that's
a
okay.
lot of thinking. There's a lot of thinking.
Exactly right. So if you want to set that up, feel free
Sure.
to do that. It is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Our number here right now, if you want to talk to Dr. Molly, 855-839-1210. I know, Dr. Molly, you're very proud of your men's health protocol.
Right.
And you've helped a lot of men so far.
Sure.
With this. So can you kind of give us an overview of what your men's health protocol is all about?
Sure. Well, first of all, obviously, it has a hydration component because a lot of guys come in and they're really dehydrated and they don't even know it. But most of my guys who come in complain, or on the intake forms and talking to them, we really look at the symptoms that are really relegated to low T or low testosterone. And you say to yourself, now these guys are burly, they're decisive guys. Well, that's it. Men present differently with hormonal dysregulation than women, very differently. And let's thank God for the differences. But what happens is that low T is much more common in men than most men know. And there was a term that was coined from integrative physicians calling andropause, mimicking what was like menopause for women. However, for men, it starts much earlier. It can start as early as late 30s and early 40s, where the testosterone levels actually decrease. So what are the symptoms of this? Obviously, low libido, hair loss, fatigue, increased body fat, some decreases in bone mass. These are the things that are really a direct result of low T. Now, also, of course, ED is a direct result. Call it low libido, but really it's the function of ED. That problem, I really believe, is caused by several things. So, yes, the urologists have come out with all these great tools now to help guys with EDs. We all know about the blue pill. We all know that there's extended blue pills and etc. But really, the idea is, shouldn't we get to the actual cause of some of these things? Why is that happening? And what other causes can happen when a man presents like this? Well, we should look at global systemic circulation, because how many guys come into me with ED that actually have problems like cardiac problems, they're on blood pressure meds, all of these things. So when we have a men's health program together, including for the ED, we really want to look at everything, including global circulation. And then we want to look at maintaining healthy testosterone levels. And the way that we do this, all the guys know about is exercise. Exercise, exercise, exercise. That, of course, will increase your testosterone level. But if you're not in shape for this and you have some other issues going on, this is where good nutritional support come in. And the best way to get that is through the IVs.
You mentioned the magic word earlier, the little blue pill.
Right.
Can you talk about the difference between your men's health protocol and a guy saying, I got a problem, I'll just get the little blue pill?
I'm all for that.
Okay, but what's the difference?
Well, the difference is, let's look at some of the underlying causes. Are we having a problem systemically, which I would tell you 99% of the time that's true? And are you on other medications that can also counteract the little blue pill or not make it as effective as you need it to be? One of the things I'm about is relationships. Okay, so you take the little blue pill. Well, what's the sustainability? The idea is we want to help you improve your sustainability. And I'll tell you why. Because, I got a lot of complaints from the wives and the partners, okay? Yeah, he's on the little blue pill, but it's not doing much for me, Dr. Molly. And, that's sort of the kind of complaint that we really need to look at, because most men are really in tune with their partner. They really are. And they want to give their partner the sustainability, and they want the sustainability. And one of the ways we do this is by offering some of the nutritional components and also improving blood flow systemically, at least 12.5%. And I will tell you that makes a difference. But back to the nutritional support, John. The nutritional support is very important. One condition, of course, we all know about the cardiac conditions that men have. The other thing is we see things like gout. More men have gout than women. Isn't that interesting?
Why is that?
I would say it's because of the level of inflammation, okay, localized inflammation. And what happens is we then give flavonoids that help in this regard. So, the other thing is men don't think of gout as an arthritis condition. And there is a pill out there for it, and most men take it. And one of the side effects of the pill, though, can also be hampering your the ED issue. So there are so many things to look at. We use something like quercetin, and that's extracted, another flavonoid that's extracted from onion skin. Of course, everybody knows we use an extract of turmeric, which is very important. And then there's some information that we want to give our men about alkaline diets. And by that, we something simple like adding lemon juice to your particular diet once a day, the omega-3s. So there's just so much to this, but I like to call it the busy man's guide to healthy lifestyle. And we can do all this, and in as little as 10 to 15 treatments, we see men improve on our program.
And I know you've had a lot. I know you've had a lot so far, but the question, I know you wanted to really address this kind of thing today. How does a man, or how do men support a healthy testosterone level? What do they do over the long haul?
Well, one of the things that I just spoke about, right, using the flavonoids. But also, I think what we want to do is we want to look out for optimal nutritional support. And the best way to get that is through the hydration. For example, there are things that we would put in the hydration. Again, I'm going to go back to the turmeric and looking at that, looking at some of the other anti-inflammatories, including vitamin C, some of the B vitamins, and of course, we may want to do bioidentical testosterone, which is a compounded testosterone that fits on the male receptors. And in our men's program, many times we utilize the bioidentical, including the acoustical wave and the hydration. It's all inclusive. And that is the best way to maintain the testosterone level as you're going through this andropause kind of situation.
So with this men's health protocol,
yes,
what's the normal course of action as far as the hydration and some other things that you do?
Well,
is it you mentioned 10? Is it 10 treatments?
Usually
15, 20?
Usually between 10 and 25 treatments, men feel the difference. And I actually had a gentleman talk to me this week. He started to feel the difference utilizing the hydration, the EDTA. We opened up his vessels. Remember me talking about chelation, getting rid of some of the toxins that also affect your hormonal levels. The xenoestrogens, they're out there. They're in, guys go out and they're doing their lawn. Okay, it's in the fertilizer. It's in the sprays you use to take care of your bushes. So we have to go in there, get those out, chelate those things out, and then put some good stuff back, like I spoke about earlier. The antioxidants, also using the things like the flavonoids, and of course the anti-inflammatories. So as little as 10 treatments, I've seen results, really good results, meaning 10 of the hydration treatments along with the acoustical wave. So right now, the big thing is the acoustical wave. Go out, get the acoustical wave. Well, that's great, except you're not really solving the underlying problem. And my sense is, so it's breaking up the blood vessels that are scarred, and I agree with that. Absolutely. That's why we have an acoustical wave for all our guys. But we believe it's really more than that. You really have to look at the systemic problems that are causing the men to have the low testosterone and why the ED.
Beyond the 10, 15 treatments, whatever it is there like a maintenance?
Oh, sure.
After that?
Sure. You'd want to come in maybe once every 6 weeks or so and get a tune-up of both the hydration and the acoustical wave. And that's something that we're committed to do. We're committed to doing. I mean, what I want to do is improve your healthy lifestyle. It's not enough, we get so specific. We get myopic. We want to go in, you want to solve this particular challenge right away, right? But you know what? It's not so simple. You also want to maintain your over global health, because guess what? All of that is wonderful, but I would guarantee you that if I spoke to your partner or your wife, they would say we want them to be healthy as well as performance.
Absolutely. We are coming up on what we call halftime here on the show. We are halfway through today's program, which means you still have plenty of time to call in with a question or a comment for Dr. Molly, a medical challenge we want to run by her. 855-839-1210 is our number here in the studio, 855-839-1210. Again, our show is Health Watch, the live version, every Sunday, 8 till 9, here on Talk Radio 1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm John DeMasi. We both return more of today's Health Watch after these words.
The Dawn Stensland Show.
Frank in the Northeast.
Just want to let you know, from 10 to 12, you are fantastic. I mean, I look forward to 10 to 12. You're the best person in radio right now. I can guarantee you that.
Sharon in Plymouth Meeting.
Thank you for all you do. I love listening to you. You present both sides of everything, every idea. You're just wonderful to listen to. You do an amazing job.
Thank you so much. I appreciate you.
Weekday mornings at 10 a.m. Only on Talk Radio 1210 WPHT and the Odyssey app.
Imagine for a moment that you went to work today, and when you came home, you were catastrophically injured. Your life and your family's life. That's what happened to union construction worker Mike Little.
I was scared of what the end was going to be, but to be 100% honest with you, I knew I was going to be all right just by talking with Brian. In my heart, I just knew everything was going to be all right.
Call the firm and find out why they say, "We got this." Call 215-458-2222.
Philadelphia Real Estate Classes is the premier real estate school in Philadelphia, serving all of Pennsylvania. They offer live streaming and live instructor online courses to get your real estate license. Call 267-266-5501 or go to PhiladelphiaRealEstateClasses.com. Their pre-licensing course has a $150 down payment to get started and a total cost of only $499, including the book, day, night, and weekend courses too. Call 267-266-5501 or go to PhiladelphiaRealEstateClasses.com. Get your license now.
For over 100 years, Deborah Heart and Lung Center has meant cardiac innovation. As a result, our patients actually get measurably better here. When you need heart surgery, insist on Deborah. Our survival rate is 10 times better than the New Jersey average. That kind of peace of mind allows you to focus on what matters the most, your recovery and your life. To experience our measurably better care, visit demanddeborah.org to find a location near you.
Hi, it's Rich Zioli. Summer's right around the corner, so make sure your AC is running right. Call my friends at Professor Gatsby's for their spring special $49 AC tune-up for new customers. I had Professor Gatsby's over to my house this winter to service my heater, and the guys did an amazing job. And I'm having them come back to make sure my AC runs all summer long. Don't wait until it's too late. Online at profgatsby.com, PROF Gatsby.com for this $49 AC tune-up special, profgatsby.com.
My name is Sonny Banks, and I'm the owner of Banks Law. Living and working in Philadelphia means a lot to me because I'm part of this community. That's why I'm personally involved in every case we handle. We're committed to helping our clients get the individualized attention that their injury case requires. Hardworking people are what make Philadelphia special, which is why we focus on workers' compensation cases. At Banks Law, we promise to work as hard as you do. Accidents happen, even at work. If you need help with a legal matter, visit us at bankslaw.com.
An Oliver AC tune-up for only $59.95 includes a safety inspection to ensure your system is running efficiently and safely.
Hello, David Oliver here. Our techs will test the thermostat, check electrical components, and inspect the indoor coil, the outdoor unit, blower, and filter.
Schedule an Oliver AC tune-up and safety inspection for only $59.95. Go to olivernow.com.
Call Oliver for all of your heating, cooling, plumbing, and electrical needs.
This program is paid for by Innovative Medical Associates.
Dom Giordano, weekdays noon till 3 from Talk Radio 1210 WPHT.
And as always, when we're here on Health Watch, operators are standing by at Innovative Medical Associates, and their number is 856-489-0505, 856-489-0505. You can call right now. And if you'd like to make an appointment to sit down with Dr. Molly, the initial consultation, remember, is complimentary, and you can really get a lot of your questions answered. And it's a really good discussion, and it's informative. And at that point, you can make your decision as to whether you want to move forward or not. Pretty simple process. 856-489-0505 is the number. And you can check out the web, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. A lot of good information on that as well, including many of our previous radio programs and a lot of other information regarding Dr. Molly and the staff at Innovative Medical. Innovativemedicalassociates.com is the website. Our program is called Health Watch, and you'll find us here every Sunday, our live version, 8 till 9 here on Talk Radio 1210. 855-839-1210 is our number here. If you have a question or a medical challenge for Dr. Molly, I want to talk about, speaking of patients, my father was a trolley driver. So here we are. We're going to talk about your patient who's a bus driver.
Right. This gentleman is a wonderful, wonderful guy. African-American gentleman who came in and he saw me. He listens to the radio. And he said, here's my problem, Dr. Molly. I went to my urologist. I've always had an enlarged prostate, another issue that I see quite a bit. He said, and his wife was a nurse. She dragged him in, and as usual. But you can understand the stressors he has just driving up to New York City. He drives the buses for New York because obviously it's better wages. He's a little north of my office, but he's in Burlington County. So you can imagine that trek he does.
That's a long drive.
Right, but God bless him. He's a family man. This is why I love, dads. I mean, he took good care of his kids. He sent his kids to college. He's just a nice guy. He's fairly young. He's in his 60s. So I said, well, tell me what's going on. He said, well, my urologist said I have prostate cancer, and he's already set me up with the surgeon and the oncologist there. And he goes, I'm a little worried. And I told my wife, I don't know if I want the surgery. And his wife chimed in. She said, well, I've seen a lot of bad outcomes with that prostate surgery. I said, like, and she said, like incontinence, etc., and ED, etc. And so I said, okay, well, why don't we start at the beginning? I said, we know you're going to need a course of the anti-inflammatories, which we will deliver through the hydration. No problem. But I said, why don't I go the step further and have your biopsy reviewed by a second opinion? Because he was very clear that the urologist told him he was a level 1 cancer, and I was concerned about the language. Level 1 cancer. I'm not sure what that means. Does that mean the Gleason score wasn't, it was like 2 or 1 or whatever? So what we did was he enrolled as a patient. Dr. Mark and I spoke about this, and I said, I think I would like to have his slides reviewed by an outside pathologist. Mark goes, nobody really does that much, Dr. Molly. I said, I know, but I can't help it. It's the biochem nerd in me. It's the laboratory nerd in me.
Right.
I said, he goes, that's a great idea. Let's request the slides. Let's get them out to an independent pathology lab, and then we can actually give him a little better advice. We're not going to tell him not to do the conventional treatments, right? Depending on what
you don't know enough yet.
We don't know enough. But in the meantime, what we're doing is we're going after the systemic inflammation. Because why? You have an enlarged prostate, but from what causes, right? Yes, we know that cancer of the prostate can cause something, but what if it's another underlying thing where it's just BPH? So, I mean, these are the things that I like to talk about and look. So the slides went out on Friday. I'm hoping to have an answer for this gentleman by Wednesday when he comes back. And we'll then put together a game plan and get second opinions even for treatment.
All right, we're going to go to the phones, Dr. Molly. We have one of our favorites. Frank is in the Northeast. Frank, good morning.
Hi, Frank.
Welcome to Health Watch.
It's funny you said that. Hi, Dr. John. I'm sorry, Dr. Molly and John.
Hey, how you doing?
I'm calling on behalf of my wonderful neighbor, Gail. I just talked to her, but she's telephone shy. With all the millions of people listening, okay?
Okay.
She saw her orthopedic doctor last week. She was having knee pain for a while.
Right.
The one knee, the pattern's kind of worn down, but it's still there.
Okay.
Other one is gone. And they said she needs surgery. She doesn't want surgery. I heard you, I believe, mention platelet-rich plasma.
Yes.
Is that something they can do for something like this? When
could be. It could be. Here's the thing. There's also some MSC cells that can be used. But it would be interesting. And Frank, see, I know underneath it, you're still the nurse. You're still the registered nurse, man. And I like that. So you're thinking. One of the things I would want to do is I'd like to get a look at her radiology reports, right? Because I think that together, Dr. Pat and I would probably take a look at this. And then Dr. Pat could make a more informed decision whether we would go right into the platelet-rich plasma or some variation of that. And in addition, maybe what she needs to do is possibly look at what other causes of inflammation are going on and possibly do a short course of chelation, the EDTA, clean some of the other stuff out, possibly put in the anti-inflammatories, and maybe put her on a course of nutraceutical treatment as well. So, yeah, the short answer is yes. Dr.
Molly, and again, she's listening. Is Gail her name?
Good.
If the pattern's completely gone, is bone on bone, does that matter? Are those options still possible?
Well, I would say the short answer to that is that's going to be codependent on who's reading those radiology reports, right? Because, again, I would say Dr. Pat is pretty good at this. And as you know, I don't waste people's money. If we can't do something for her, we certainly won't charge her. In other words, we want to do the right thing. She's a great candidate to come in for the free consult, bring the radiology, let us look at it and see if there's something we can do for her,
Yeah, I think you ought to bring her in, Frank.
Yeah, I'm going to tell her to call you tomorrow.
Okay.
Outstanding, Frank.
Okay.
Outstanding.
Thanks a lot. Appreciate it.
Thank
All
you.
right.
God
Frank,
bless you, Frank.
Thanks
Have a
lot
great
for the
day.
call.
It's nice to hear
Good
from
luck
you.
with
Bye-bye.
that. Good luck with your friend. Let's talk to Joe in Mount Airy. Joe, good morning.
Hi, Joe.
You're on Health Watch with Dr. Molly.
Good morning, John. Good morning, Dr. Molly. Happy
Hey,
Father's
Joe.
Day.
How are you, my friend? Oh, you too. And God bless you, Joe. Happy Father's Day.
Thank you so much, Dr. Molly. Dr. Molly, before I talk about the vaccine, Frank kind of stole my thunder. I wouldn't even mention it, but since Frank brought up about Miss Gail, I might be coming to see her too. But I had surgery on I had a torn meniscus in my right knee, and the doctor did a surgery. He did a decent job. He at Temple University, but it still had that same flexibility that it once had. Like when I sit down like in a kneeling position, I don't get as much flexibility as the left knee and everything. And I may just come in and see if I might be a candidate for that.
Yes.
Yeah, I may just come in at some point.
Oh, you know what, sir?
Joe.
Let me tell you, Joe. You know what? I absolutely want you to. I don't know if you heard me last week. We had a young gentleman, again, now he had youth on his side, but I will tell you something. We were able to actually help him with a complete reversal of a tear of the AC. I am telling you, there are so many things. And part of this, Joe, is the additional nutraceuticals that we tell you to get on, which I remember. I know you, Joe, from the radio here, so I know that you're a naturalist. You really understand. Yeah, you really understand the need for the anti-inflammatories and the need for the flavonoids and these kinds of things. So I absolutely would urge you to come in for the free consult, and I'll tell you. And you know what else? Bring your radiology reports with you, okay, and the discs. All right? That will be helpful. Yeah.
And what I'm going to do, Dr. Molly and John, I'm going to probably, guys, I'm going to probably come see y'all sometime in August. I'm going to call that 489 number that John mentioned over the air. I'm going to call and make an appointment with your wonderful staff sometime in August. But real quick on COVID and stuff, I read in the paper where Dr. Fauci came down with COVID.
Now How ironic is that, huh?
I know. They said he had all the shots and the booster and everything like that. And yet he still came down with it. And you know, the funny thing is, my personal doctor, she just won a recent lawsuit because her insurance company was threatening not to deal with her because she wanted ivermectin. She won her lawsuit, so now they have to let her prescribe ivermectin at an on case by case basis with her now. So that was a nice victory for her. And lastly, Dr. Molly and John, you know what's concerned about me about this whole COVID thing? Now, if adults want to get the vaccine, that's their choice. But I'm still not comfortable, John and Dr. Molly, when they keep saying they want to prescribe this stuff for children. Now, if you want to take a chance as an adult on messing your life up, possibly, but why do that to a child? A child don't have no decision. You don't know what this stuff is improving, John and Dr. Molly. You don't know what the long-term damage that can do to an infant or a toddler or 3, 4, 5-year-old child. I mean, why I don't know how these pediatricians can go along with that stuff, man.
You know why. Now wait. You understand, right? Your doctor had a big problem just talking about the ivermectin. Can you imagine being a pediatrician today? Even if your philosophical bent is that you don't want to give out something that you really don't believe in it, guess what? You're at the mercy of what to do because guess what? You don't fool around with this thing because they'll take your children away from you. But and it's not right. It isn't. I understand. We're supposed to have medical freedom in this country, and believe me, I understand, Joe. I really do. And I'm going to tell you something that I definitely know about this COVID. Lots of my men who've come in post-COVID shots and who've had COVID have a big drop in their testosterone, and it's affecting their brain fog. They're getting brain fog, and they can't function in the real world at this point. So believe me, I understand this.
Joe, thanks a lot.
Thank you.
You're welcome.
God bless
you. Thanks a lot for the call. We appreciate it.
God bless. God bless.
It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. And I'm John DeMasi. Bob and Ben Salem, hang in there. We'll get to you after the break, and maybe we'll talk to you at 855-839-1210. We're coming back with more of today's edition of Health Watch after these words. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505. You heard Joe say earlier he's going to call. Well, that's what you should do. If you have a medical challenge you want to discuss with Dr. Molly, you set up that appointment. It's complimentary, 856-489-0505. Again, 856-489-0505. And just because we leave the show here at 9 o'clock doesn't mean they're going home. They're there all day, all right? It's a sunny Sunday. It's Father's Day. No holidays for the operators, all right? 856-489-0505. And don't forget the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And we should remind you that if you miss any of today's show or you want to hear it again, we have our Health Watch replay Sunday afternoon, 4 till 5, here on Talk Radio 1210. And again, it's Health Watch, our live version, Sundays 8 till 9. We're going to go to the phones right now. We have Bob and Ben Salem. Bob, good morning. You're on Health Watch with Dr. Molly.
Good morning, Bob.
Hi.
Good morning.
Hi. I just wanted to mention to you that it's your transmission that's garbled, not my phone. So I'm on a landline, and I noticed that the advertisements were as clear as a bell, and it's your voices that are having a problem. But anyway, I just thought I'd mention, Dr. Molly, that it's exactly a year ago that I came in and I was discharged from a well-known hospital in Lower Bucks County here. The best they could do is get my temperature down to 100.
Oh, yeah.
And I thought that I had COVID, and I tested negative, and then I thought I had malaria because the symptoms were very similar, if you recall.
Yes.
And I thought I was on the way out, to tell you the truth.
Oh, my God.
And then you took over and cooked up something there in your lab, and lo and behold, you got me back on my feet again. So I just wanted to remind you of that, because that was really bad times for me.
Thank you. Thanks so much, Bob. And of course, I remember this. You have a wonderful wife. You're a smart guy. And we really love having you as a part of our clinical family. Let me tell you something. You're not alone in this. This virus, whether it's COVID or not COVID or some subset of COVID, has wreaked havoc with people clear across the country. But in addition, pretty significantly here in our tri-state area. And I do remember your case. And I think the other side of that, of course, Bob, is that we became COVID crazy. And no matter what, everybody had it. And so that then people really didn't look at some of the other symptoms people were having, and they didn't treat appropriately. So I appreciate the call and the good wishes. And I want to tell everybody out there, I have really wonderful clients and patients who come in to see us who are smart thinking people, and thank God that you're not myopic.
Bob, how you feeling now?
Oh, I'm top of the world.
God bless you.
But I just want to emphasize something, that the doctors in this hospital, they just threw up their hands and said this is the best we can do, and they discharged me.
Yeah,
I was in there twice, once in, and then it came home, and then the next day I was back in there, and I was up to 104, and the best they could get me down to was 101, 100, right in there. That was it. So if it weren't for you, I would have cooked.
Oh, my God, please, no.
Wow.
Honestly, thank you, Bob. And, what I believe is the man upstairs took care of both of us.
Yeah, Bob,
God
thanks
bless
for the call.
You. God bless
we're glad
you, Bob.
that you're feeling better.
He's a wonderful guy and a good patient. And, he comes in with his wife. And I will tell you, John, that's not an unusual story.
I was just going to say, how many times and patients have told me, I sit in your chair twice a week, and patients have said to me, I went to such and such, and they said there's nothing more they can do for me. I mean, you've heard that many times.
I have, and I thank God every day because one of the things that definitely is a problem, I tell you, most people are dehydrated. Imagine you're running around with that kind of fever and nobody's putting an IV in your arm over at the hospital. I mean, come on. Yeah. Let's get with the program.
104.
Right.
104.
Let's get with the program. And we all know that inflammation is our enemy. When it's out of control, what does inflammation do? It causes havoc on our body. Period. End of story.
I know you wanted to mention this. You were talking about brain fog.
Yes.
As a result of COVID exposure.
Yes.
And this has become somewhat of a common problem.
Big time.
Can you touch on that for a moment?
Yeah, sure. In one of the things that happens is that the neurologists have been doing studies on people who've been exposed to COVID, people who've done the shots from COVID, et cetera. And what they're finding is there's a pattern that develops. Well, the endocrines find that you have low testosterone. Testosterone is also an important part of men's brain health. Not just the little brain, but the big brain too, okay? So it's important. And what happens is testosterone drops, so there's an issue. But also there's a problem with the communication of the particular neurons in the brain. And we actually have a protocol for the brain fog for post-COVID, which is similar to a protocol that we've used on our chemo patients who are suffering chemo brain. It's brain fog as a result of the chemotherapy, which means the free radicals that the chemo has put in the body. Now, the question is, most guys just accept this, that they're getting older and they're just not as sharp. I'm going to tell you that isn't the case at all. There are men in many men that we've seen well into their 70s and 80s. I'm going to tell you, John, who calls in here, John is, I don't want to say how old he is. I like to think of him as 40, but he's significantly older than 40, and he has some problems. But I'm going to tell you, he's a very intelligent guy. He's sharp as a tack. Most of my patients are like that, as opposed to just sitting and saying goodbye to life.
What do you do with if you? Well, you may not even know that you've got brain fog.
That's right.
So
You just don't know.
How do you treat that?
Well, we treat it with anti-inflammatories. We treat it with neuronutrition, specifically that works on the brain. We treat it with amino acids, and we may want to treat you with a little bioidentical testosterone. So that there are many things that we can do for the brain fog, if that's the issue. But again, I think that's a symptom of overall inflammation. It's not just a symptom. It's worse in the brain, but it's a symptom of overall inflammation.
We have about 2 minutes left.
Okay.
And I know you wanted to touch on this. You had a new patient this week.
46 years old.
And this one, wow, this is I saw you the other day carrying her medical records.
Yes.
It looked like a book.
Well, it is a book. And here's the unfortunate part. This is a young, healthy, beautiful woman who had chosen to get some breast implants. She read all the FDA studies. She did everything right. Unfortunately, her body has been making her inflammation towards these. She had them out. She's also suffering right now from a multitude of autoimmune symptoms and a multitude of test results that are all indication of inflammation, systemic inflammation. So my job, as I see it, along with my physicians, is to help put the fire out in her body.
That's the first thing you're going to do.
Absolutely. Put the fire out, because she's totally inflamed. Her cascading, she has more challenges. Every single one of her tests that we did for autoimmune is positive. So she's got some problems, and I know that we started already, and her sister told us she usually has a hard time getting started in the morning. She couldn't wait to get to our office on Friday morning, which told her sister that something's changing.
And just what, 1 or 2 treatments so far?
Two treatments and some changes that I've asked her to do in terms of her nutraceuticals. But I am going to tell you, this is going to be an interesting case, and I'm going to be happy to report it back to our listeners, because
you'll keep us posted.
Again, she did everything right, John. She followed the FDA guidelines. So there it is.
Sometimes that doesn't work, right?
Yeah.
That's why you're around.
Well, I can say you need a little more than that.
And that is going to put the wraps on another edition of Health Watch. Don't forget, if you'd like to make an appointment to sit down with Dr. Molly, operators are standing by right now, and they'll be there well after we leave you at 9 o'clock. 856-489-0505. 856-489-0505. And check out the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, you missed any of today's show, we have our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, and fabulous Fran, Joanne, and our nurses, Jess and Lana, and our medical assistant, Caring Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. Happy Father's Day. We'll do it all over again next Sunday. Health Watch, the live version, 8 till 9 on Talk Radio 1210. You take care.
Paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.